We hear a lot about patient optimization in spine surgery over the past several years, but we haven't heard much about malnutrition and how we can optimize our patients' nutritional status before spine surgery. So I'd like to discuss that with you today. I'd like to talk about the incidence and impact of malnutrition in healthcare, review the literature demonstrating the correlation between poor nutritional status and poor outcomes, and discuss an evidence-based approach to optimizing our patients prior to spine surgery. We hear a lot about smoking cessation, diabetes, obesity, but we hear very little about malnutrition, which is ironic because up to 55% of the patients we admit to the hospital are malnourished. And what's worse is almost 70% of them will be more malnourished when we discharge them. I think we all realize that nutrition is very important in healthcare, but until recently there hasn't been a lot of studies to show us exactly how important it is. Over the past 2 to 2.5 years, there's been more than 25 studies published in the orthopedic and spine literature showing poor nutritional status is one of the most significant risk factors for postoperative complications. Here's one of those studies. This is a review of 4,000 lumbar fusion patients. They diagnosed malnutrition as having an albumin level of less than 3.5. And as you can see, patients who were malnourished were significantly more likely to have postoperative complications, readmission, and longer length of stay. Here's another study from over 3,600 anterior cervical patients showing the same thing. Patients who were malnourished were more likely to have postoperative complications with a relative risk of over 3.3. And yet another study, full 100% Medicare sample from 2005 to 2012, showing again malnourished patients were 4 times more likely to have any major complication. And another study of elective spine surgery patients showing the same thing with readmission rates. Patients who were malnourished were 3 times more likely to have a readmission within 30 days. Here's another study of posterior cervical patients, over 1,500 of them, showing the same thing. Malnourished patients were much more likely to have complications. But what's interesting about this article is they found BMI and diabetes did not correlate with increased risk of postoperative complications. That's different what we usually hear. But this study also shows the exact same thing. Patients who were malnourished were much more likely to have postoperative complications. And they found that high BMI, regardless of the class of obesity, was not associated with increased complications within the 30-day postoperative period. So, malnutrition is an independent risk factor for postoperative complications, but the question is, what can we do about it? We have the option of consulting the dietitian or trying to convince our patients to change their daily diet, give them Boost or Ensure something or anything, or give them something that is evidence-based and proven to improve outcomes. That something is called immunonutrition. It's a combination of immune-modulating nutrients, arginine, glutamine, omega-3 fatty acids, and nucleotides. With over 700 peer-reviewed publications worldwide since the 1990s, there's a plethora of evidence showing the efficacy, safety, and cost-effectiveness of immunonutrition. Here's a great article that summarizes 173 randomized controlled trials, all showing patients who received perioperative immunonutrition had fewer post-op infections, shorter length of stay, and fewer overall complications. Here's one of those studies that shows patients who had immunonutrition prior to surgery had a 51% reduction in postoperative infections and a shorter length of stay. And another study with over 1,000 patients showing the same thing. This study, they evaluated immunonutrition's effectiveness in well-nourished patients. They had two cohorts, malnourished patients and well-nourished patients, and compared to the control, both groups had a greater than 50% fewer postoperative infections. What about cost? Well, we have multiple studies that show the cost effectiveness of immunonutrition. In this one, patients who received perioperative immunonutrition had a cost savings of $2,600. Here's another study showing that patients who received perioperative immunonutrition had a $6,000 cost savings pertaining to length of stay and a $3,300 cost savings based on reduction of infectious complications. So immunonutrition is effective, it improves outcome, it saves the hospital money, and patients have fewer complications, fewer readmissions, and shorter length of stay. Malnutrition is the most significant risk factor for postoperative complications, arguably, and there's a simple solution. Patients can drink immunonutrition, 2 bottles a day, 6 days before and 6 days after surgery. Studies show immunonutrition is most effective when taken between 5 and 7 days pre-op and between 5 and 7 days post-op. So that's exactly what I do for my patients. I give them Ricochet nutrition 6 days before and 6 days after surgery. Given the current evidence, I believe we cannot optimize our patients fully before surgery until we optimize their nutritional status.